Alright, so you've learned about joints, and so we want to talk about some problems with joints, some joint disorders. So we've talked about what a joint is, the different types of joints. You've had your synovial joints and your synarthrotics, your diarthrotics, and all that good stuff. So now we want to talk about some things that can go wrong, because we always like to talk about the normal and the abnormal. And so when we think about joints, we think about places where two bones come together and how they're held together. And so often you'll hear sprains and strains, and a lot of times we use those interchangeably when actually they have different meanings. So a sprain is an injury to a ligament, which is the bone-to-bone connection. A strain is a injury to a muscle or tendon, which is that muscle-to-bone connection. So again, sprains and strains are going to be the injuries to the things that are connecting the muscles and the bones. Okay, so sprains or ligaments, strains or muscles and tendons. Now, it doesn't really matter if you sprain something or strain something because you treat it the same way. And the treatment for both is called the RICE, which means you rest it, you ice it, you compress it, and elevate it. And so you're going to, lay down, put your feet up, ice it, and hopefully the swelling will go down and it will heal on its own. Now, a sprain or a strain can be a pretty bad thing because, again, if you're thinking about ligaments and tendons, you're thinking about connective tissues, which may or may not have some good vasculature, so they may not heal very well. So sometimes it's actually better prognosis if the bone is broken. The bone will heal faster many times than a sprain or a strain. So just when someone says, oh, they sprained their ankle or they strained their ankle, that doesn't necessarily mean it's okay because it may take longer to heal than a broken bone. Another inflammation or problem of the joints is bursitis, and that's an inflammation of the bursa. And if you remember back to our talk about the bursa, whenever we have a muscle, and like here's the muscles in our shoulders, and here's the acromion part of our scapula, if you've got movement in your shoulder, you don't want that muscle here to rub against the bone, okay? So our bodies will put a bursa, a little fluid-filled sac, kind of like a little synovial cavity, a synovial fluid-filled sac between the bone and the muscle as a cushion. And so if you have bursitis, an inflammation of that, then maybe the bursa is flattened out or thinned out or has become inflamed, and so you're going to get pain with movement. So as that shoulder's moving, you're going to get that muscle rubbing against that bone. That bursa is going to be real inflamed and tender. This tends to happen if you do repetitive motion. So if you have a job or a hobby that has you doing the same thing over and over and over again, so maybe constantly lifting your arm or something like that, you may get bursitis. Obviously, as you get older, you tend to increase your risk as you get older with bursitis, again, due to repetitive actions. As with sprains and strains, you do rest and ice. You may also add an NSAID, and we'll talk to you about what that actually means. You may have heard that, but you don't know what an NSAID means. You may do physical therapy and maybe steroid injections. So when someone says, oh, just take an NSAID, I just want to make sure that you know what that means. NSAID is a non-steroidal anti-inflammatory drug. And so when you go to the pharmacy, if you see the brand names Advil and Motrin, that's ibuprofen. That's a form of an NSAID, a non-steroidal anti-inflammatory. So this is over the counter. Aleve is naproxen sodium, and Bayer is aspirin. So not Tylenol, okay? It is not one of these. So if you're having pain, you're walking a long time, or you're playing tennis and you've got some bursitis or joint pain, you may want to try one of these brand names, which just means that you're taking one of these generic names: ibuprofen, naproxen sodium, or aspirin. These will be cheaper. So once a company makes if you don't know this, once a company makes a new drug, it comes out as a brand name and it has the high price tag. But then after a while, the patent expires on it and they get to make it as the cheap version. So if you can, the cheap version works just as well as the brand name. But that's what an NSAID is. So osteoarthritis. It's the most common form of arthritis, and it means the top layer of cartilage breaks away and wears down. So if you think back to bones, and we said we had that articular cartilage on the ends of bones where the two bones would come together and form the joint. Well, if that cartilage is no longer there, then the bones are going to rub together. The cartilage is not there to protect it anymore, and you're going to get that kind of a crunching sound, and it may cause pain and swelling and redness. You may even get, if you have a bone here and a bone here and the cartilage is gone, the bones may actually form little bone spurs to protect themselves from the other bone, try to protect themselves from that crunching and that bone-on-bone contact. Osteoarthritis can be caused from several different reasons. Being overweight, so think knees. A lot of overweight people will have the crunching of the knees because the bone on bone, the meniscus can wear out and be gone and cause bone on bone crunching. So just getting older can cause osteoarthritis. Arthritis. The old football injury. So if you've ever had an old knee injury, old shoulder injury from a sport or a car wreck or something like that, maybe it didn't heal correctly, and so you've got some osteoarthritis. Maybe the joint's not properly formed. Maybe you have some kind of scoliosis or some kind of improper joint formation. Maybe it's genetic. And again, stress from jobs and sports. You can't really diagnose it. It's not really a single test. It's just you have the warning signs. So you may have stiffness in the joint. It may be swelling. It may be tender. It may have a crunching sound or feeling. So if you have that in a joint, then it's probably osteoarthritis. They can maybe do an X-ray or MRI and check it out. To treat it, they're going to do exercise, strengthen the muscles to help stabilize the joint. Weight control, losing weight puts less stress on the joints. Rest and pain, maybe taking an NSAID or maybe a steroid or some other kind of medicine. Now, osteoarthritis is usually going to be localized. Okay, so you don't have systemic osteoarthritis. It may be of your knees, your elbows, or maybe in your neck, but it's usually localized to an area, one or two areas in your body, not all over your body. Okay, which is different than rheumatoid arthritis. Okay, rheumatoid arthritis is an autoimmune disease that affects your joints. And it's going to be all over. It's autoimmune means your own body's attacking yourself, okay? And it causes pain and swelling and stiffness. This is a picture. When you see someone with rheumatoid arthritis, they have these big knotty-looking joints. It's usually going to be a systemic, and a lot of times in the hands and feet. You'll definitely see it in the hands and feet. Real common in middle age and women and older people. But there is rheumatoid arthritis in juveniles, so it can occur in young people. They're going to give you anti-inflammatories, maybe an immune suppressant, something to try to get your immune system to stop attacking you, maybe physical therapy, and possibly surgery. Okay, so rheumatoid arthritis is systemic, multiple joints involved, and it's because your own body's attacking you, whereas osteoarthritis is localized, and it's usually due to age and repetitive stress. All right, that brings us to Lyme arthritis. So you may have heard of Lyme disease. And this is caused by a type of bacteria that is carried by ticks. So when the tick bites you and it puts its mouth parts in your mouth, the bacteria leaves it and goes into your body. And it was named for Lyme, Connecticut, I believe. And so they found this condition showing up in people that were bitten by ticks that were found on deer. And so if Lyme is spread throughout the country now, so if you're out in the woods a lot, especially in the spring and the fall, summer, when there's a lot of ticks, you want to wear, long clothing and tick repellent and things like that. But if one happens to get on you, these are what the warning signs that you're looking for Lyme disease. And it has different stages. We have an early and a midterm and a late stage of Lyme. And if you catch it early, you can cure it with an antibiotic because, again, this is a bacteria, and so an antibiotic should take care of it. But you've got to get the antibiotic taken when you start to fear that you've been exposed to a Lyme-carrying tick. So if you have been bitten by a tick and you see this telltale bullseye, okay, so maybe you've already removed the tick and a couple of days later you notice this rash. This is a very telltale sign that you may have been bitten by that particular tick that has that Lyme disease. You may see a rash, you may have fever, it may feel like the flu, which is one reason, especially in the fall of the year, you may not even realize this is what's going on, because fall and winter we have flu season. And so you've been out in the woods, maybe a tick bit you on the back and you haven't noticed it and you haven't seen the bullseye, so sometimes it's misdiagnosed because flu season and Lyme season can overlap. So if you see this bullseye, make sure you get to the doctor. So if you miss this stage and don't get your antibiotic, it can move into the second stage, which can be serious. It can cause meningitis, which is an inflammation of the tissues around the brain. It can cause a neuropathy, which is a nervous system disorder. Pericarditis, which is inflammation around the heart. Myopericarditis, which is another inflammation around the heart. So both of these, or all of these, can be serious and possibly fatal. If you survive the midterm, what you're left with is a lingering arthritis, so a long-term chronic arthritis. So again, take precautions, wear long clothes, use permethrin or DEET, use some kind of anti-tick preventative to prevent yourself from getting bit by a tick and being exposed to Lyme disease. All right, and then finally we have what's called gout or gouty arthritis, and this is pain and inflammation that occurs when uric acid, which is just a byproduct that we have in our bodies, it can crystallize. So it doesn't happen in most people, but in some people the uric acid, they have so much it crystallizes and deposits in the joint. And so this is a kind of a diagram of that, where you can see these little crystals of uric acid getting in between the joint and causing swelling and pain. And this is what it would look like from the outside. And so if you have severe gout, you're going to have severe pain, you're going to have redness, swelling in the joints. A lot of times this will come on suddenly and at night, and a lot of times in the big toe. That's just a common place for people to get gouty arthritis or gout, is in their big toe. Again, treatment for this can be NSAIDs, and that can help to shorten the attack and shorten the severity of it. But again, sometimes if you're having trouble with this uric acid, which is a nitrogenous waste product, they may have you change your diet. Okay, so people that have gout a lot of times will undergo diet changes and try to prevent that buildup of uric acid in their blood. All right, so just a couple of lifespan changes. We're talking about joints. So what happens with our joints as we age? Well, remember, the fontanelles are literally joints between the cranial bones in the infant, right? So by age 2, we close those soft spots. So those joints are now solid. Think about the cranial sutures; they've become solid. The synchondrosis on your growth plates and your sternum disappear. So if you remember, your sternum was actually 3 bones, and so now it's 1. So all that fuses. Nothing's ever good as you get older. As you get older in your 40s, the joints become less flexible. They become stiffer. The cartilages and all the accessories that make up a joint, but they just stiffen. They're not as flexible, so you start to have stiffness and pain. The collagen starts to change. It's not as resilient. As you get older, for the very same reason, the fibrocartilages in your spine start to harden and they lose their flexibility. So you start to lose flexibility in your spine, so it's kind of hard to bend over and touch your toes. And so I always tell my students, if you can do it now, don't stop. If you can do a back bend now, if you can touch your toes now, do it every day, okay? The longer you do it, the more flexible you'll stay for a longer period of your life. Okay, so make sure you're flexing those joints, flexing that back, and maintaining flexibility. So as long as you're active and exercising, that can help keep your joints healthy and flexible. Okay, they will stiffen up probably as you get older, but the more you do, the kinder you are to your joints, the more you use them, then the kinder they'll be to you and the less stiff they'll be as you get older. All right, so that's all I'm going to talk about now, and I will see you in the next video. Thank you.